So scabbing and crusting is very common after a hair transplant, and it almost universally occurs 24 hours after the procedure. Anytime your body has a trauma, it will create a healing response, and hair transplantation is no different. In order to implant hair in the scalp, typically a small poke is made in the scalp. As a result of this poke, your body will try to heal itself. In an attempt to heal itself, a scab will form. In addition, skin can also clump together with the blood to form crusts. This is very common after the first 24 hours. While the scabbing can be concerning for patients, we don't recommend patients try to pull the scabs out, and here's why. If you try to pull the scabs out, guess what you can pull out with it? The newly implanted hairs. It's better to keep spraying along the hairs so that the scabs and crusts will eventually fall off on their own. At 10 days after the procedure, you can start submerging your head underwater and letting your hair soak. What this will do is eventually it'll gently dislodge those scabs when they're ready to. Just like a scab knee will start the whole process again if you pull that scab off. We don't want your hair and scalp to get further irritated. One way you can treat these scabs is to hydrate your skin with one of our topical medications called Aqua Profundo. Essentially, this is going to allow the skin to heal itself faster.